another very brief review. In this case, it's of an ECG. This is the big and obvious things about ECG. And here they go. First off, wow, what an embarrassingly oversimplified graph this is. Again, ECG, electrocardiogram, or EKG, electrocardiogram, where the K stands for cardio, a German spelling of the word for the heart. This right here would represent a flat line in which there are no electrical disturbances in and around the area of the heart. And that means no activity whatsoever. And that's what you would recognize in a movie as the ooh noise in which, okay, things aren't good for the patient. Any kind of deviation from that flat line is called deflection wave. And the deflection wave represents the size of the electrical disturbance. And that implies the number of cells that were involved. So a small deflection wave would represent a relatively small amount of cells were being involved, as in atrial depolarization. A larger deflection wave would represent a larger number of cells, as the QRS represents ventricular depolarization. Now, this, of course, should have been way bigger if I was drawing this thing to scale. After the ventricular depolarization, there is another wave called the T wave, and this represents ventricular repolarization, sort of the echo of this thing right here. Now, there was an atrial repolarization, but that little echo was overwhelmed by the side of this QRS, ventricular depolarization. This next bump right here is the P wave for the next cardiac cycle. Here are some general things about the heart rate. First off, tachycardia. Tachycardia represents a faster than normal heart rate, about 100 plus. Bradycardia represents a slower than normal heart rate, about 60 or less. Now, it turns out that there are several factors involved in whether your heart rate might be faster or slower. One is age. Younger people tend to have faster heart rates. Older people tend to have slower heart rates. Body temperature. Higher body temperature tends to imply a faster heart rate. Lower body temperature, perhaps a slower heart rate. Activity levels. If you're very active, your heart rate will be faster. And if you're not very active, it'll be slower. And females in general tend to have a higher heart rate than the average male does. So again, stupid way to remember this is young, hot, fast females are being chased by old, cold, slow men. So very sad. Here's something else that's a bit odd. Arrhythmia versus dysrhythmia. The words are contingent as to what they really mean to the average person, but A means no, dys means bad. So therefore, if there is no pattern whatsoever, that can be called arrhythmia. A flat line is a good example of arrhythmia. Dysrhythmia also says it's got a bad pattern to it, and people's careers are based upon being able to read dysrhythmia. So a very important concept to be able to interpret in the future. One example of a dysrhythmia that's very dramatic is fibrillation. Well, this would represent a cartoon version of atrial fibrillation, and this one ventricular fibrillation. In this situation right here, there is no coordination of the muscle contraction. It's like ectopic foci everywhere, and the bag is just jiggling back and forth and jiggling back and forth, and so the pumping is just not there. Speaking of not there, cardiac arrest. In cardiac arrest, there is no contraction, so again, flat line. Here's another concept right here, and that's heart block. If the SA node has a rhythm of about 100 to 75, and the AV node has a rhythm of about 60, then if these two are connected, this will dominate that. However, if anything blocks the signal going from the SA node over towards the AV node, then the AV node may be running on its own little rhythm. So you now have two people dancing at two different rhythms. If there is some sort of blockage between this number and that one right there, then that means the AV node will now dictate to the ventricles how fast they will beat. And it could be approximately 60 or even less. So it should have been 75, but now it's going to be less. So again, like two dance partners cha-chaing to a different rhythm, somebody's going to step on somebody's foot. By the way, the normal rhythm of cardiac muscle down inside the ventricle is around 30-ish. And that's just way too slow for the heart to be efficient. Here's something else to look at before we throw this thing away. PVC, standing for pre-ventricular contraction. It's supposed to be both atria contract while the ventricles are relaxing. Then both atria relax when the ventricles contract. But sometimes you'll get a second contraction. And that second contraction is sort of like a hiccup. in your heart, or it's sort of like your heart is skipping a beat. The main thing is it messes up the efficiency. Please remember that the atria above and the ventricles below should be like rowers in a rowboat who are trying to row in coordination with each other. If they're coordinated, everything moves smoothly. In a situation like this, the coordination is gone, the efficiency is gone.